A dairy cow presents with a sudden drop in milk yield, cold ears, and watery, foul-smelling diarrhea. The herd recently switched to a high-energy ration. What is the most likely diagnosis? A. Protein-losing enteropathy. B. Subacute ruminal acidosis. C. Traumatic reticuloperitonitis. D. Winter dysentery. Answer B. Sudden diarrhea and decreased production after feed change strongly indicate ruminal acidosis. A dog exposed to ticks presents with thrombocytopenia and shifting leg lameness. Which test best confirms the suspected disease? A. Fecal flotation. B. 4DX SNAP test. C. Schirmer tear test. D. Coagulation panel. Answer B. A SNAP 4DX detects common tick-borne pathogens causing thrombocytopenia and polyarthritis. A horse shows facial nerve paralysis after being tied tightly with a halter. Which nerve was most likely compressed? A. Trigeminal. B. Accessory. C. Facial. D. Glossopharyngeal. Answer C. Halter pressure can injure the facial nerve, leading to muzzle deviation and eyelid drooping. A 3-month-old kitten has seizures, ataxia, and hyperammonemia. Which condition is most likely? A. Portosystemic shunt. B. Hyperthyroidism. C. Diabetic ketoacidosis. D. Toxoplasmosis. Answer A. Young animals with neurologic signs and high ammonia suggest congenital shunts. A flock of young chickens shows respiratory distress, swollen sinuses, and decreased egg quality. What pathogen is most likely? A. Infectious bronchitis virus. B. Foulpox. C. Histomonas meleagritis. D. Newcastle disease virus. Answer A. IBV causes respiratory signs and affects eggshells and albumin quality. A dog with suspected Addison's disease must be tested. Which diagnostic is most definitive? A. ACTH stimulation test. B. Urine cortisol creatinine ratio. C. CBC and chemistry. D. Abdominal radiographs. Answer A. Addison's is confirmed by inadequate cortisol response to ACTH. A cow with a left displaced abomasum will most likely show which sign? A. Metal ingestion. B. High-pitched ping on the left side. C. Severe dehydration. D. Black tarry feces. Answer B. A classic LDA finding is a left-sided high-pitched ping due to trapped gas. A dog presents with hematuria after cyclophosphamide chemotherapy. What preventive drug should have been given? A. Atropine. B. Ondansetron. C. Mesna. D. Furosemide. Answer C. Mesna prevents cyclophosphamide-induced sterile hemorrhagic cystitis. A horse with strangles remains febrile weeks after infection. What complication is suspected? A. Bastard strangles. B. Thrush. C. Recurrent airway obstruction. D. Laminitis. Answer A. Persistent fever indicates metastatic abscessation, known as bastard strangles. A ferret presents with weight loss, chronic diarrhea, and rectal prolapse. Which diagnosis fits best? A. Insulinoma. B. Adrenal disease. C. Helicobacter musteli infection. D. Elution disease. Answer C. Helicobacter causes chronic GI disease and strain during defecation. A dog's thoracic radiograph shows a widened mediastinum and lymphadenopathy. Which disease is most likely? A. Megaesophagus. B. Lymphoma. C. Pulmonary hypertension. D. Pneumothorax. Answer B. Mediastinal widening is strongly associated with lymphoid neoplasia. A horse colics after being fed a large amount of grain. What is the most likely condition? A. Gastric rupture. B. Cecal displacement. C. Gastric dilatation. D. Ileal impaction. Answer C. High grain intake leads to gas production and stomach distension. A cat with hyperthyroidism shows elevated liver enzymes. Why? A. Toxin ingestion. B. Hepatic lipidosis. C. Increased metabolic stress. D. Parasitic migration. Answer C. Excess thyroid hormone elevates metabolic activity and stresses the liver. A newborn calf shows severe difficulty rising and an absent suckle reflex. What deficiency is suspected? A. Selenium. B. Vitamin A. C. Copper. D. Thiamine. Answer A. Selenium deficiency causes white muscle disease, weakening skeletal muscle. A dog is treated for ventricular tachycardia. Which drug is most appropriate? A. Enalapril. B. Lidocaine. C. Pimobendan. D. Sucralfate. Answer B. Lidocaine is the drug of choice for emergency ventricular arrhythmias in dogs. A goat presents with anemia, bottle jaw, and poor body condition. What parasite is most likely? A. Coccidia. B. Haemonchus contortus. C. Tapeworm. D. Strongyloides. Answer B. Haemonchus causes severe blood loss and submandibular edema. A cat with urethral obstruction shows bradycardia. What is the cause? A. Hypothyroidism. B. Hyperkalemia. C. Dehydration. D. Hypoventilation. Answer B. High potassium interferes with cardiac conduction, causing slow heart rate. What is the primary treatment for canine idiopathic vestibular disease? A. Emergency surgery. B. Supportive care and anti-nausea medication. C. Radiation therapy. D. Corticosteroids only. Answer B. Most cases resolve with time. Supportive care controls vertigo and vomiting. A horse with choke is first treated by A. Passing a nasogastric tube with gentle lavage. B. Feeding warm mash. C. Administering NSAIDs orally. D. Performing tracheotomy. Answer A. Gentle lavage through a stomach tube helps dislodge esophageal obstruction. A dog shows elbow effusion and pain when rising. Which condition is most likely? A. Osteochondritis dissecans. B. Panosteitis. C. Cruciate tear. D. Hip dysplasia. Answer A. OCD commonly affects elbows in young, large breed dogs. A cat with hypertrophic cardiomyopathy is most at risk for which complication? A. Aortic thromboembolism. B. Hypothermia. C. Cushing's disease. D. Laryngeal paralysis. Answer A. HCM predisposes to clot formation that can obstruct the aorta. A dog has chronic weight loss, ravenous appetite, and greasy feces. Which condition fits? A. Exocrine pancreatic insufficiency. B. Gastric ulcer. C. Hypoadrenocorticism. D. Heartworm disease. Answer A. EPI causes maldigestion, large appetite, and fatty stool. A rabbit presents with head tilt and nystagmus. Most likely cause? A. E. Cuniculi infection. B. Roundworms. C. Vitamin K deficiency. D. Dental abscess. Answer A. E. Cuniculi commonly causes neurologic signs and vestibular disease. A cow with mastitis shows watery milk, high SCC, and clots. Which pathogen is typical? A. Campylobacter. B. Staphylococcus aureus. C. Mycoplasma bovis. D. Clostridium novii. Answer C. Mycoplasma mastitis produces abnormal milk and spreads rapidly in herds. A dog tests positive for heartworm antigen. What is the next essential step? A. Start doxycycline. B. Immediate melarsamine injection. C. Administer furosemide. D. Perform echocardiography. Answer A. Doxycycline reduces Wolbachia bacteria and decreases complications of treatment. A mare due to foal shows dripping milk and relaxed pelvic ligaments. What stage is she entering? A. Estrus. B. Early gestation. C. Impending parturition. D. False pregnancy. Answer C. Udder fill and ligament softening indicate foaling is near. A dog with Cushing's disease is best monitored with which test? A. ACTH stimulation test. B. Urinalysis. C. CBC alone. D. Progesterone assay. Answer A. ACTH stim is standard for monitoring trilostane treatment response. A horse with laminitis often develops rotation of which bone? A. Radius. B. Navicular bone. C. Third phalanx. D. Coffin joint. Answer C. P3 rotation results from laminar weakening and pull of the deep digital flexor tendon. A dog presents with continuous bleeding after minor cuts. Which test identifies platelet function defects? A. Buccal mucosal bleeding time. B. Blood glucose. C. Fecal occult. D. Serum protein. Answer A. BMBT detects platelet abnormalities, not coagulation factor issues. A turtle shows swollen eyes, poor appetite, and lethargy. What deficiency is likely? A. Vitamin E. B. Vitamin A. C. Calcium. D. Iodine. Answer B. Vitamin A deficiency leads to squamous metaplasia and swollen eyelids in reptiles.